All right, the floor is yours.
All right. Hello, everyone. Welcome to another edition of our Vision and Learning webinar. My name is Dinah, and I'm happy to see you all. For those of you who are joining us for the first time, we do have a recording of last month's webinar on our Facebook page. So you can find it there if for whatever reason the link's not working, or if you don't have a Facebook account, you can just send me an email and I'll share the YouTube link with you. I'll post my email address up later on. So welcome to October. October is the National Awareness Month for both ADHD and dyslexia. And those are two diagnoses that commonly have vision problems associated with them. And if it's left untreated, it could really hamper a child's success. So as most of you know, I'm a vision therapist, and I've been a vision therapist for the last 14, almost 15 years. I've been a mother for 13 of those years. So vision and learning, as you can see, is not just my career, it is what I come home to every day. And I'm committed to making sure that my children and you and your children can feel empowered. And one of the ways that I can do that as a vision therapist is to build confidence in visual skills. Over the years, I've worked with some amazing doctors, and Dr. Susan Daniel is one of those doctors that shares the same passion that I do. As a parent, she has her own experience with vision and learning and autism and ADHD. She's a current member of the College of Optometrists in Vision Development, and she's the past president of the Neuro-Optometric Rehabilitation Association. She provides in-services for school districts, parent groups, and even some continuing education for professionals speaking at Autism Society of America and the World Behavioral Vision Seminar. Since treating her own vision therapy patients back in 1991, she now has 4 doctors and 4 therapists on her team. Ladies and gentlemen, here is Dr. Daniel.
Hi, thank you for being here for our second webinar, and I'm so excited that you have joined us. Like Dinah said, I have personal experience as a mom with the challenges of raising a child who has some special needs or some difficulty with learning and attention. And so I have a child with autism who is now 22, and a daughter who has ADHD, and so I had some experience with that. I've been an optometrist now for 29 years, going on 30, and this is my passion, is working with children with learning disabilities and difficulty with visual skills that hamper their learning. So here are the definition from the AOA, which is the American Optometric Association, of learning disabilities. And it's a group of disorders that have significant difficulty with both spoken language, written language, and mathematics. And so the prevalence of learning disabilities in the United States is pretty high, in that there is 7.1 million children, and 14% of all public school students have special education and need special education services. And out of that group, 33% of them have specific learning disabilities. And that's another name for difficulty with reading or dyslexia, ADHD, and just not living up to their potential, their potential in learning, depending on what their IQ is. So let me move to the next slide. So with undetected vision problems, they're a big concern because they can hamper the ability for a child to learn efficiently. And so that's what's called learning-related vision problems. So we have really two sets of visual skills that are developed starting from a baby on up. And we have two different categories. One is the ability to efficiently gather visual information. And that is including whether they can see clearly, whether they need glasses for astigmatism or farsightedness or nearsightedness, how the eyes move, in that are they able to fixate and follow a target in space? Can they jump fixate from one point to another like they need in reading? Also, can they accommodate, which is our word for the ability to focus from near to far. And this is not focus, pay attention focus, but focus making clear, like adjusting the camera lens to make it clear both near and far. So that's one of the skills that is developed, where the brain has to change the shape of the lens on the inside of the eye in order to make it clear both near and far. And you can have focusing problems even if you see 20/20 on an eye chart, and that makes it difficult for learning. And then the third most difficult skill in the input skills is the ability for the two eyes to coordinate together as a team to form one image. So you have the image of the right eye and the image of the left eye. They overlap to form one percept that has depth to it. But when there's a difficulty in the alignment of the eyes, whether it's an intermittent eye turn or a tendency for the eye to turn either in or out or up or down, then that can cause a lot of symptoms where it hampers with learning. The second group of visual skills is once the information is received efficiently, then how is the brain processing what you're seeing? And this includes non-motor aspects of visual perception, thinking, cognition, and their integration with like visual motor skills, visual auditory, language development, vestibular, which is a word that describes where our body is in space, and also whether we get dizzy or not, and our balance, and then our attention systems. So I'm going to go over some signs and symptoms of these different problems. So the reason why I wanted to show this is that many people do not associate some of these problems with the vision. And the reason why is that vision problems are silent problems. You know, you can look at someone and they look like they have good eyes, and the person who has maybe some of these vision problems are not aware that these problems are caused by their vision. And so if you have a speech problem, then people know, hey, you need to see a speech therapist. And if you have a physical problem, then you need to see a physical therapist. But vision problems are not easy to detect. So the way to know whether your child or your student needs a specialty type of vision evaluation is to look at some of these symptoms. So for eye movement dysfunction, what we see is that the child may be moving its head excessively while they're reading back and forth. They skip lines when they're reading. So as they go to one line, they may skip an entire line. They may omit words or transpose words while they're reading. Losing place is a very common problem, to where they may need to use a finger or their marker to keep their place. And they may have difficulty with playing ball sports, and you may, toss them a ball, and they, they're afraid of the ball coming towards them because they're not able to track it and see where that ball is accurately. Some of the symptoms of focusing and eye teaming problems is that you'll get some eye strain when you're reading or writing. Headaches that are associated with visual tasks are usually in the front and on the side of the head. With focusing, you may have difficulty with that blurred vision at distance and near that can fluctuate. With eye teaming problems, you can have double vision. Like the pictures below, the images, instead of being entirely two separate images, they can be where the images seem to be sprayed or just on top of each other or floating. And you can see that you can still read what it's saying, but it's much more difficult, especially if the print is moving, and that's what the appearance is like. I had these difficulties when I was a kid in that I had one eye that turned in, and I saw double for the first 17 years of my life. And I never had an eye exam. I had a school screening where you cover up one eye to see the eye chart, and I could do that, and then cover the other eye to see the eye chart, and I could do that. But nobody ever asked, do I see two eye charts? And I did. And so what ended up happening is that I would turn my head to block the image out of the one eye so that I didn't see double, or I would just close one eye or get really close to the paper. And so those are some things that you're going to look at in your children to see if they have any of those signs. One of the things too is that it takes a lot of effort to maintain the focusing and the eye teaming, and that the stamina of holding it together. And by doing that, we tend to stare. And when we stare, then our eyes can burn and tear during visual tasks. Mostly at near, but you can have that happen in the distance as well. Some of the things that we're also looking at is being able to tell spatial orientation. Now, when we talk about it is where the difficulty of where am I and where is it? The where am I means that does the child have the ability to tell where their body is in space? And if you don't have that, then you cannot tell where an object is in space accurately. So first comes where am I, then comes where is it, where is the object, and then comes the what is it, the visual discrimination. Can I tell what that thing is that I'm looking at? And that is the sequence of development. When a lot of movement is required in order to develop a child's sense of where they are in space. And so creeping and crawling and climbing and swinging and all of those things tell the patient where their body is in space. And that comes before you can have the eyes coordinate together as a team and focus and track. The other thing is that it's important for a child to learn to cross the middle of their body, and we call it crossing midline of the body or crossing midline of their visual system. And so up until the age of 2, a child will take an object from the right side of their body, transfer it in the middle of their body, and then put it on the left side of their body. They don't have the ability to yet pick up the object, cross it over their body in order to place the object. So what they'll also do is pick up the object, turn their whole body in order to place the object. They need to be able to learn that crossing midline, which occurs right around the age of 2, in order for them to be able to cross visual midline in reading. And there are a lot of children who at 7 to 10 years old still have difficulty with crossing their midline. And when that happens, then that causes a whole host of problems with the eyes not coordinating together as a team and the ability to track across a page. You'll see delayed development of gross motor skills that is caused by a visual skill. You'll have confusion of where is my right and where is my left on my body. And that's a normal thing that is learned up until age 7. So if you still see that it's difficult for your child to tell their right and left on their body and in space past age 7, then that's an issue that you have to work with. Because if you don't have a sense of direction on your body, then you won't have it in space, meaning mean you'll have more letter and number reversals, and you may be reading from right to left instead of left to right, and have difficulty with that directional attack when you're reading. You'll also, visual spatial orientation problems affect coordination and balance in ball playing as well. And one of the things that we look for too is that has the child after age 5 developed a dominant hand? Are they right-handed or left-handed? When you still have an inconsistent dominant handedness to where sometimes it's right, sometimes it's left, that has been shown to have more association with children who will have learning problems, because they haven't developed that sense of where their body is in space and have that directionality on their body. Some of the signs and symptoms of visual analysis skills are that difficulty of determining what is it that I'm learning at, and that can be shown in delayed learning of the alphabet. You can have poor automatic recognition of letters, and so you know, in our English vocabulary, we have our phonetic words where you can sound them out, and then sight words to where you just have to memorize what the word is because it doesn't make sense if you try to sound it out. So if you're not able to automatically recognize a word that you've known before or seen before, then that is a sign too that you may have some learning visual challenges. You have difficulty in spelling and also confusion between similar looking letters and words, some transpositions like was and saw. And if a child is reading and they're mixing up these little words and transposing, then what they're reading doesn't make much sense. Now, often these learning problems are not as apparent to others until around 2nd grade, because if you look at the kindergarten and 1st grade books, a lot of the books have pictures and also just one line per page, or 2 or 3 lines that are spaced really far apart. So if you have a tracking and analysis problem, you're still able to figure out what the story is about. But then 2nd grade, it really changes because now you're reading in paragraphs, the words are closer together. You have to be able to track and follow and then make a picture in your head of what you're reading in order for it to make sense. And so we see a lot of children that come in because their symptoms are more apparent right around 2nd grade. Some more symptoms of visual analysis skills are that difficulty to perform basic mathematic operations like division and multiplication, subtraction and addition. Difficulty for visual search tasks. I call this the where's Waldo, being able to find Waldo in a picture. But this is even being able to find ketchup in the refrigerator or find out where your socks are when they're right in front of you. There can be some spatial confusion. I put a measuring tape because it's that difficulty of telling where in space you are compared to the objects that may be in the room or in the world. More symptoms are difficulty with attributes and categories, being able to separate things by size and shape and color. That automatic recognition of what's different and what is the same. And then also sequencing, being able to memorize a sequence of objects or letters or words and put them in the proper sequence. So these are some signs and symptoms of visual motor integration problems. And you'll see from the demonstration on the left of a child who has problems with their writing and spatial organization, staying on the line, and there's some reversals of letters as well. You'll also see kids with visual motor integration problems, difficulty with copying from the chalkboard, a lot of mistakes and confusions, that transpositions, and staying within that printed line, like I said. here's some more, a misalignment of numbers and columns when doing math problems. One of the things that we suggest when a child has that difficulty is to do your math homework on graph paper instead of just line paper, because it then aligns the numbers going up and down and side to side, and it helps the child know how to align the numbers so that they add and subtract and multiply the correct numbers together. You'll have, with visual motor skill deficiency, more written spelling problems than oral spelling. The posture makes a big difference with writing, and you know, we can go as developmental optometrists into a classroom of children and can tell who will have who has decreased visual motor skills and what we call central and peripheral integration skills just by their posture and their head tilt. And you'll see even how they move their paper. It'll be exaggerated when they're writing, and their pencil grip will be awkward. So what do we do about all of these symptoms and signs? And those are the things that we ask about in our children's survey that a parent or teacher will fill out for us, so that we know what tests to do. So when we do the testing, we're not only checking the eye health and whether they need glasses for visual acuity, but which we call the hardware of the visual system. We're also checking all of the software of the brain. How is the brain analyzing what you're seeing, and how is it controlling those input skills? And there's really 3 different evaluations that we do. A regular comprehensive exam that checks the eye health and visual acuity, the visual efficiency evaluation, and then the visual processing information. And when we finish those, we find a profile of that child and develop a plan to help those skills. One of them could be using different types of lenses. Like in this example on the screen, you'll see that in the picture A that the child has an eye, the left eye, that is turning in. It's a crossed eye. And that's a particular condition that is called strabismus, or accommodative esotropia. It's the fancy name for that. They need glasses in order for their eyes to align so that they don't see double. So this is one type of eye turn that is corrected with lenses. Onto the right side of the screen, you'll see glasses that have a very thick type of lens, and this is for testing. This is something that somebody would wear in this high of power, but it's a type of lens called a PRISM. And what a PRISM does is look at takes a child's misalignment of the eyes, and the PRISM moves the images so that they're closer together so that the brain can fuse them to make one image. That's called a compensating PRISM that we may put in their glasses prescription. There's other types of PRISM, like the one in this picture that's called a yoked PRISM, that actually just moves the spatial perception of the world that the child is seeing. And then we do different various activities to have them adapt to where things are so that they're looking and touching at the same time, like being able to look and tap the ball while they're maintaining their balance. And then we change the lenses so that direction so that they have to readapt. And what that does is give them a better sense of where their body is in space and improve their spatial projection. We also use different tints and filters. Different colors affect the autonomic nervous system, and I'll be going into that a lot more in detail in our next webinar series. But tints are very powerful in not only changing contrast in what you're seeing, but also decreasing the visual confusion and headaches and light sensitivity, as well as balancing the autonomic nervous system so it can decrease anxiety and increase attention. And then you'll see on the bottom right, there is what looks like tape on a pair of glasses, and that's a type of selective occlusion. So a child who has an eye turn, like the example above, that is not corrected with just a prescription glasses, they may wear certain types of occlusion that when their eye is crossed, the tape occludes that eye image so that the patient doesn't see double. And then they have to work on in therapy to align their eyes and look beyond that tape in order to use both eyes together as a team. So I just mentioned vision therapy, and you're probably wondering, what is that? Well, vision therapy is a series of activities and using lenses, prisms, filters, and inclusion, and different activities to help develop the focusing skills, eye teaming, tracking, and visual processing skills. So what I'm going to do is give you some examples of some different types of therapies, and there are thousands of different activities that we do that are specifically programmed for each child that we see. So this is one of the activities that we can do to improve visual tracking. So you'll see there's a paragraph of what looks like words that make no sense, and that's on purpose. And what the child has to do is underline the letters until they find an A, and then keep underlining the letters till they find a B, and then a C, and then a D. And they go through the paragraph as quickly as they can in finding the letters of the alphabet in the sequence. And if they don't miss a letter, then they'll end up on Z. If they do, then they're not going to end up on Z. And we time it, and that's how, and we do one of these for each eye, and practice it each day. And as it gets faster, then the print size gets smaller and smaller and smaller. And that helps with the visual tracking and helping with learning to read. We also have equipment that measures the eye movements while the child is silent reading. Now, you may say, my child can read out loud just fine because you're using the auditory system to help make sense of what you're reading. And if you're skipping and rereading, the paragraph isn't going to make sense. But the problem with silent reading is that you don't have that auditory component to tell you whether this paragraph is making sense. And so what these goggles do is that they have sensors that measure how the eyes move as the child is reading a paragraph. So you'll look at the test results on the right side, and you'll see one of the columns that looks like a staircase is the right eye, and the other column is the left eye. And if the eyes are coordinating together as a team, it'll look like a staircase where it's coming down, and then you get to the end of the line of the paragraph, and then you go to the beginning of the next line. And so a person who is a good reader with good eye tracking skills, it will look like the charting on the right. When we see children whose eyes are not coordinating together and not tracking well, it'll look more like what is on the left side. You'll see where the two lines are intertwining, and that means that the eyes are crossing. They're trying to read. They're not going from left to right, they're more going up and down, and then their eyes cross, and then they come back, and then they cross again. And you can imagine how confusing that is when you're trying to understand and comprehend what you're reading. Doesn't make much sense when you're going out of order. So this is an activity that is training a few different things. Now, when we're doing activities, we start with doing therapy for the most basic skills first, which is the eye fixation and eye tracking, then go to focusing, then go to eye teaming, and then do all three at the same time, and then do all three with movement and balance, and then with a cognitive demand and an auditory demand, so that it becomes a generalized skill that you can use in everyday life. Because we're not just sitting looking at a stationary object all the time. We're moving in space, and the objects are moving in space, and we have to be able to take in all that information quickly, accurately, and have stamina doing so. So this, we start with it simple, and then we make it more complicated. So this is a more complicated activity. The child is using magnification and minification lenses that stimulate the focusing system to where the child has to, it'll see blurry, and they have to make it clear. And then you flip the lenses and it goes blurry, and you have to make it clear. It's using filters. You'll see a red and green lenses that are on her eyes. And what that does is that the right eye that has the red filter will only see what she's looking at on the paper if the brain is turning on that eye. And the left eye has a green filter, and the left eye will only see what's on the paper if the brain is turning on the left eye. And why is that important? It's because when you have an eye turn or a tendency for the eye to turn, the patient has either two choices. It'll see double, or the brain will shut off one eye. And when it does that, the patient is not aware that they shut off one eye. So they may be reading along with one eye shut, and then their brain switches to the other eye. And you'll see that the images will jump from one word to a word that may be three words down on the paragraph. Well, this gives the patient a feedback, a biofeedback to tell them to turn both eyes on in order to do this activity and be able to focus. And then you see she's on a swing. So she's in movement, and then she has an auditory stimulus as well on the headphones. This is an activity that we do for training spatial awareness, and there is these dots on a plexiglass picture that is in front of them. They have to take their finger, look, and then touch as quickly as they can at each dot. We may put letters that are out of sequence to where they have to look at A, be aware of where B is, look at B, look at C, look at D, and have the eyes point to exactly the plane of where that object is, and that helps with spatial awareness. You'll see that they're doing monocular skills because one eye is patched, and it's using a lens, magnification and a minification lens to also challenge the focusing system to make that dot clearer and for you to have accuracy for exactly where that dot is. This is a child that is doing an activity called the Brock string, and it works on eye teaming. So for those of you in the audience, I want you to hold up your fingers in front of you and first look at your finger that is closest to you. As you're looking at the finger that's closest to you, you'll notice that there's two fingers in the background. And then when you look at the back finger, you'll notice that there's two fingers in the foreground. And that is what's normal. And so this activity uses a string with beads to do the same thing that you were doing with just your fingers. But what it also incorporates is the string. Now, if your visual system is working correctly, you'll see two strings that cross right at the bead that you're looking at. And then you'll see two beads in the foreground. Then when you look at the back bead, you'll see two strings in the foreground, but the string is crossing right at the bead. That's what a normal response is. If the eye is over crossing, then the cross in the string will be before the bead. If the eye is turning out, then you'll see the cross in the string behind the bead. So this gives the child the feedback of, am I looking exactly at the bead? Are my eyes accurate? And so if they're looking behind the bead, then we tell them to try to overcross to try to get that cross right at the bead. Then we make it harder by using a PRISM lens, and that's what I'm holding in my hand. We put that in front of the one of the eyes, and it challenges, all of a sudden that bead is now double, and the eyes have to either, depending on what prism I put on, have to either converge the eyes to make it single or diverge the eyes to make it single. And then we do it to where we try to make it faster and faster to where they can move their eyes as quickly as they can. And that will help with when objects are coming at them quickly, to be able to tell exactly where it is in space, like a ball, or later when they're driving. It's a really important skill. So here's another example of a vision therapy activity to where I want you to take your finger, put it in the middle of the screen between those two rectangles. Look at your finger, and as you bring your finger closer to you, you'll notice in the background that those two circles will form a third circle in the middle. And then you stop when it gets 3 circles. If you keep going, you'll get 4. So you want to find, there's like a sweet spot here where you'll have 3 circles. When you get that, then you try to focus on it without looking back at the screen, but focus on that middle circle to make it clear. And when that happens, then you'll see a 3D dimension. And this is another way for us to train the eyes to coordinate better, and for the eyes to coordinate and make it clearer at the same time. Then we can do this activity by also while walking in space in a like in an obstacle course, so that they're aware of a central activity and being aware of their peripheral space simultaneously. Now, many of you will try this activity at home and not be able to do it. Don't worry, it takes some training. Some people can do it right away, and some people it takes some training in order to do it correctly. Here is another example of doing an eye-hand coordination task with balance and body control. A child is on a balance board, which you can't see, and hitting a ball that's suspended on a string. The advantage of having the ball on the string is that it moves in a pendulum. And so if you're training on spatial awareness and speed of where things are in space, when you can anticipate a pendulum and the speed is the same each time, then it's less scary and the ball doesn't hit the child. So you'll see a lot of children, you throw a ball to them and they're like this again. This is the right training for that. And so we're having this child hit the ball with the bat and or bunt it, and then also maintain their balance. And then there's letters on the ball that they have to identify the letter that they're hitting. So it's that central, peripheral, vestibular, visual motor integration all rolled into one activity. This is another one where the student is learning to play tennis, and he was having a hard time tracking the ball. So we put him on a trampoline where he had to move a little bit like he would with tennis, and the ball comes towards him and he has to cross over. So it's looking and hitting and tracking and maintaining balance simultaneously. This is one of the activities that we do for depth perception, where the student will see the images pop out toward you like a 3D movie. And then we can move the slides to make it harder for them. They have to cross more, or they have to diverge their eyes more. Once you get a good sense of that 3-dimensional space, then it locks in that ability for the eyes to coordinate together as a team correctly.
Great.
Now this is a short little video showing how one of the activities that we use to train where is my body in space in right and left directions. So we come to the edge of the square, they'll see what direction they need to turn. They'll have to say right and touch the right side of their body, because when you have a motor movement with a verbal and then with direction, then it centers more, just like we have this motor memory. And then when they come to the next edge, they have to tell us what direction. So here's a little video.
Left.
Is that left?
Right.
Are you sure?
Yes.
Okay.
So this one is one of the activities that does learning attributes and categories. So this student had difficulty with size and shape and color and direction. And so he's putting, you can't see, but he has a yellow triangle on the whiteboard, and he's putting descriptions of that triangle, whether it's big, whether it's turning up, and what color it is. And then we have a special piece of equipment at our office that it's called the Sensory Learning Program. And it incorporates visual, vestibular, auditory, and stimulation of the autonomic nervous system simultaneously for the brain to learn how to coordinate those sensory systems. There's a diagnosis called sensory integration dysfunction, and for children who have problems with being able to look at you and listen to you simultaneously, be able to have visual motor integration, maintain their balance, and process what they're listening to. And so what this particular equipment does is that the child lays down on the bed and looks up towards a light source. That's the thing that's on the top. They're in complete darkness except for the light source. And then the table moves. It goes up and down and side to side, and then side to side and forward and back. And so each day that they do the treatment, the therapy, then the table moves in a different direction. And what it's doing is tracking, stimulating the eyes to track better and to work better together as a team and coordinate those senses. So I'm going to talk more in detail about that at the next webinar next month. And so if you're interested in that, or it seems like it would be great for one of your students or your child, then you can visit me on that webinar too. So here are our 4 optometrists at our office. Dr. Camilla Dukes, who's been with me for 20 years now, myself, my husband, Dr. Davis, who's been with me 33 years, and Dr. Janess, who's been just with us a few years. And these are our wonderful vision therapist, Dinah, who just met. She's a certified optometric vision therapist, which is a person who has gone through very extensive training, oral exams and written exams in order to become premier vision therapist. And she's one of a few in the United States, and I think is one of the top therapists out there. And we have 3 other extraordinary ones that are also working towards their certification, and it's Melissa, Felicia, and April. So thank you for listening, and I'm going to head this over to Dinah, and she will show you a few more things.
Thank you, Dr. Daniel. So actually, before I share my screen, I wanted to open it up to all of you. If there are any questions or anything that you wanted to share with Dr. Daniel, we have Dr. Daniel's time, and you can ask her directly. So I was gonna say, you can unmute yourself and ask the questions, or if you're comfortable typing it in the chat box, Brooke and I can monitor the questions. Oh, you're welcome, Cassie. So let's see. Does anyone have any questions for Dr. Daniel?
And just a reminder, if you're looking to unmute, you can press your space bar, or also on your Zoom screen, there's a mute button in the left-hand corner.
And I should also say that if you don't want to ask your question in a public forum, please feel free to email Dinah or myself, and we can answer your questions about your specific areas of interest.
Dr. Daniel, would you mind sharing your experience as a parent dealing with the autism and ADHD, vision and learning?
Yeah. Well, 3 of my 4 children all did vision therapy with our various therapists and Dr. Dukes, and I was their mom. And so I was their encourager. But they, with my son, who is nonverbal and autistic, he had all of the sensory integration problems, and every symptom that I talked about, he had all of them. And so he had many years of vision therapy, and he did the sensory learning program when he was 6 years old, and that changed his life and our life to where it improved his ability to walk. He said his first word after that. He was able to sit and pay attention and have feedback with other therapists and teachers and his family. So that was huge. And with my daughter, who has ADHD, she also had problems with her hips, and so was in a brace for the first couple of years of her life. And then she had, my light went off, then she had surgery on her hips and was in a wheelchair for a while. So she didn't have the motor experiences to learn her right and left, and to develop that where am I in space. And that affected her attention in school. Even though she's extremely bright, she is now an occupational therapist. And so she's doing a lot of these activities too from an occupational therapy point of view. But she has now that experience as a student of vision therapy, and now as a practitioner. And then my other daughter, she had vision therapy just to help with her anxiety. There was a lot of anxiety due to her tracking difficulties and paying attention. And her anxiety decreased substantially after she did really all the programs with vision therapy.
And Sarah has a question.
Hello.
Yeah, we have a question. Go ahead, Sarah.
Hi, can you hear me okay?
I'll try. I'm hearing impaired.
Yes.
Okay, I have a question. Thank you, Dr. Daniels, for the presentation. I was informed by a clinician, since my son has an IEP, that perhaps this is something that I can request through the school district to handle the expense. Is that something that was relayed to me correctly, or do I need to get more information, or what has been your experience?
Yes, that's correct. And we are contracted with all of the school districts, pretty much all, in San Diego County, way out to Ramona, all the way down to Chula Vista, and then up into Orange County and LA. So we have patients that the school district will, after we do our evaluation, which you can ask for, specifically ask for a optometric developmental visual evaluation, not an eye acuity test from the school nurse, because they'll think vision checked.
Okay.
But it's a very different type of evaluation. And then after that evaluation, then if there's recommended vision therapy to improve the educational progress of their IEP goals, then the school district may pay for the vision therapy. And so we have a good number of our students have IEPs, and I have, because my son has autism, I'm in the autism mama world. And so we have a lot of children on the spectrum and who are contracted with the school district to have their vision therapy paid for at our clinic.
Would you be able to, I think it's Dinah that I communicated through email, so that I request the correct terminology that you use there?
We have a sample letter that you can request it to the district representative of special ed.
That would be great. Thank you.
And there was a question that came up, if we tailor our vision therapy, and Dr. Daniel can add to this, but as a vision therapist, I can tell you in my 14, almost 15 years of being a vision therapist, on paper, these patients may seem like, oh, they have this, 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 and this, just like this patient. So their vision therapy should be almost exactly the same. not the case. Every child has their own personality. And I think I can speak for a lot of vision therapists when we say that we want for our patients to enjoy coming and to be engaged. And the only way that we can really engage them is to get to know them as a person, and then put their personality into some of the activities. So it is very much individualized, but I think even from an objective standpoint, when the doctors do these certain measurements, there are certain intensities, right? So if we're working on eye teaming with one patient, they may have a more significant issue than, let's say, another patient. Dr. Daniel, would you agree?
Yeah, that's exactly right. And that, yes, in my 29 years, not one patient has had the same program as another. And that is wonderful for us too. It's a very creative and wonderful profession. Vision therapists are the best. And they have that connection with the students that, and it's not, we're not doing reading and arithmetic. We're doing the skills that are needed in order to do those efficiently. And so the children have nothing to compare it to. They're not being compared to another student. It really builds their self-esteem as they see that they're able to do these activities better. And if they really hate one activity, there is a zillion other ways to teach the same skill. And we just change it to tailor it to that patient. And our vision therapists and our doctors work hand in hand. So every single time that, Dinah sees one of my patients, after she's seen them, then we program the next session together, and we have that communication. So I'm kind of in the background while they're doing their sessions. And then typically every 12 sessions, then we do another progress eval with the treating doctor. And that helps us, helps the parents know kind of, are they on the right track of how many sessions that you think, you're estimating? Are they a little behind? Are they a little ahead? What other areas have you found now that they've improved these skills that you may want to work on? And so it gives that communication. But we're always in communication with the parents when they need us. And that's the cool part. I have one patient right now that probably emails me every day, and I love it because it has significant vision problems. I had a brain injuries, and his life is changing every single day so much. And so that helps me tailor his vision therapy as well. So good question.
And there was
Dinah, did you see the other questions on here in the chat? There's quite a few.
Yes. So there's another question. How common or standardized are some of these vision therapies in the US or in other countries? Also, how old or new are some of these specific techniques in terms of literature and research?
Okay, so I should have done one at a time.
Okay.
So with the literature, I'll do the last one because that's what I remember. The literature and research, we do have a lot of that if you want us to send it to us. But also you can look at the College of Optometrist and Vision Development website, which is covd.org. And they have their journals and references for these vision therapy techniques. Now, vision therapy is also very creative. And so once you know the theory of what you're trying to accomplish, say you want to develop the ability to do tracking and upgaze, then you can develop many different vision therapy techniques for that particular skill. And that's where you're going to see some differences between some vision therapy offices than another, is that it also depends on the creativity and the knowledge base of how that therapist understands the theory of vision. We do have, I should say, our office is rather unique in that we have educational seminars every single week with the doctors and the therapist. And the therapists share their cases, and we are constantly educating each other as well as going to continuing ed. And so that's why our therapists teach other doctors. We have fourth year optometry students that do rotations at our office to learn these skills, and we get a new one every 3 months. And it's our therapists who are teaching these new doctors because they understand this better than they do. So what was the other question, Dinah?
The first part of that question was, how common or standardized are some of these vision therapies in the US or in other countries?
Yeah, so there's a certain set that are pretty standard. Like with some of the activities that I showed today, you'll see those at all of the therapy offices around the world. And then like I said, some of them are not. Now the testing is rather standardized. You know, there are, when we write our reports, there's the Grofman test and the Berry test, and you know, all of the doctors name these tests after themselves, but but they have these standardized tests so that if I did the evaluation, another doctor could do the therapy, which is how San Diego School District works. They have a different doctor do the evaluation. They send us the evaluation records, and then we develop the therapy plan, and vice versa. Most of the school districts have the evaluator also do the therapy, which I prefer, but some of the school districts work differently. And then I say there are some differences, you know, between therapists. Our office is really known for learning disabilities and autism, stroke and brain injury. And so we see kind of the kids that have, the kids and adults that have a lot of severe delays and deficits. So not all offices, our office is really known for autism because of all that my son has taught me over the years.
And then there was a question asked if vision therapy is for dyslexia. Could you give us your input on that?
Yeah, so dyslexia is a multi-pronged treatment effect. So dyslexia, just the word itself, means difficulty with reading. Now, there are many visual problems that need to be addressed prior to or in addition at the same time as phonological and language therapy that works on the language part of reading. And so when a child has been diagnosed with dyslexia, it's very, very important to have a developmental optometry evaluation to make sure that those skills are up to par. And if they are, then we know you only have to do this educational therapy like Lindemood Bell or Orton Gillingham therapy. But often these kids are struggling on two bases. They have both the language part difficulty with dyslexia and a visual part. And the visual part is completely treatable. And when you do treat that, then the child has much better energy to work on the other parts of dyslexia.
And William has a question. What does the process look like from start to finish when considering vision therapy or neural rehabilitation for a friend or family member at Daniel and Davis Optometry?
Okay, so I will, so yes, so with the process that we do, if you have a person that you want to refer to us, or you have a child of your own, or you are related to our people at our office, when you call to make an appointment, you let our front desk know. They'll be asking you, does your child have any special needs, or were you referred by somebody? And that helps us to decide what type of evaluation to do. If you're saying, you know, my child is autistic or has learning disabilities and I want to check how his visual development is, then there's 3 appointments that are made. The first one is a visual history appointment. We send you a questionnaire that's quite long, but we want to go over all those signs and symptoms. Then one of our therapists, like Dinah, will make a phone call history appointment that can be up to an hour, so that you can go over in detail what your concerns are with your child. And then we set up an appointment with the doctor. And then I have all that information already with the history, so that once you bring your child in, I can go right to seeing the patient, so they don't have to listen to us chit chat about their long history, and have full attention on the child. After they see me for the first half of the evaluation, then the second half of the evaluation is a different appointment with the vision therapist to do more of the testing. After that is done, usually that part's on the same day. Then we set up one more appointment for a consultation. So I will write a report over all of the tests and recommendations for your particular child. And then I have the parent and parents come to the office without their child. And then I spend up to an hour talking to them about their specific child's results and recommendations, so that they're fully informed and understand the underlying basis of why we're recommending it.
And there's a parent has a question for their child. How would they go about getting their child tested for dyslexia? Should they start with the pediatrician or with the school district?
Yes, there's two ways to go about it, both what you just described. Through the pediatrician, through your health insurance, will pay for a evaluation with a developmental pediatrician or a psychologist who specializes in dyslexia, so where it can be covered under your medical insurance. There's some limitations to that, in that it's not, there are some different levels of expertise that are on the insurance panels of those doctors. So there's also through the school district, through an IEP, which I definitely recommend to do. There's what an IEP is, for those who don't know, is an individual educational plan. There's different, when a child has difficulty in school, the first level is a student study team, or SST. It's kind of a powwow between the student, the parent, and the teachers to go over what things that we can do to help that child succeed in school. The next level up is a Section 504, which are, if they have these visual difficulties or other difficulties, visual motor problems, like they can't do their handwriting, we'll teach them how to use keyboarding. And so those are accommodations that are given. And then an IEP, a 504 is a contract between the student and the school. An individual education plan is a contract between the student and the state. So that means that there's if you request a IEP for your child, the school district, within 15 days of a written request, has to do a full testing, and you can choose what testing, including a visual developmental exam. But they look at all of the, there's a occupational therapist, school psychologist, educational specialist, and they do a full panel of testing to determine if the child has specific learning disabilities. And then with that, you have a contract in which to ask for services to help remediate those difficulties.
And Cassie, she has a question for you. Go ahead, Cassie.
Hi, Dr. Daniel. I am actually in my third term right now of my doctoral studies for occupational therapy. So that was really awesome to hear that your daughter does that. I guess I'm just interested in knowing, it sounds like there's possibly some special certifications that OTs can get to better assist with this sort of thing, especially because I'm really interested in pediatrics, and so I'll probably be seeing a lot of this. So yeah, I'm just kind of curious to know what things maybe I could look into for later on, just to help, help with you guys too.
Oh, absolutely. Occupational therapy and vision therapy have a lot of overlap, which we work really well together. And so my daughter and I discuss cases every single day. And so, and she works with both adults and children. And so there are a lot of things that you can learn as a OT from the visual perspective. And I'm so happy that you came to the webinar to kind of see, oh yeah, I see that. And what vision therapists do with lenses and prisms and therapy that may be different than what you can do. But then also as an OT, there's a lot of that sensory integration and central peripheral activities that you can incorporate into your therapy. So actually email me. We do have a lot of OTs that come to our office or to our training sessions, and if you're local. And if not, then I can connect you to some other educational places that you can learn from.
Okay, and you're in San Diego, is that right?
In Carlsbad, in northern San Diego.
Oh, okay. Yeah, so I'm in LA, but I'm kind of a nomad right now because I'm doing online classes. So, but I would love that. I will definitely email you. Thank you so much. This was really a cool informational.
All right, thank you.
Thank you. These are some great questions, but our time is running out. But if you have any more questions, please email us. Again, I'm going to show our email information in just a little bit. But thank you, Dr. Daniel, for your information and for your time. And thank you everyone for just joining us today. I really wanted to make sure that these webinars are like a conversation versus a presentation, and a conversation can't happen without all of you. So I really appreciate your input. And with that being said, oh, Dr. Daniel, may I?
Did I share the screen?
Yeah.
Okay.
Okay.
I think I unshared it. There you go. Okay.
Yeah. Okay. So as a thank you for joining us, we wanted to offer a $50 voucher to use in our Carlsbad location. As you can see, it doesn't expire until October of next year, so you'll have plenty of time to use it. Just send me an email and then I can reply and attach the voucher for you to print out and then bring in with you. And be sure to join us next month. As you remember in her presentation, Dr. Daniel spoke a little bit about the sensory learning program. So next month, she'll have the opportunity to go into more detail about sensory integration and the syntonics behind that. That's going to be Thursday, November 19th at 6:30. And then here is our information, our phone number, and then Cassie, there's our exact address for you. I've included our general mailbox as well as my direct email. So please reach out to us if you have any questions. Thank you again for being here. Thank you, Brooke and Leslie, for your help for today. But with that being said, stay safe, everyone. And then again, email us if you have any questions, or maybe there are some topics that you'd like for us to cover in some future webinars. Just let us know. All right, everyone. Thank you. We'll see you next time. Bye.
Bye.
Thank you.